Now, South African hospitals have recorded more COVID-19 deaths during the second wave compared to the first wave last year. That's according to a study released by the National Institute for Communicable Diseases. Now, it's not yet clear if the higher deaths are due to the newly discovered variant or whether it can be attributed to the strain placed on hospitals by the sharp rise in infections. The variant was first identified in December and now dominates transmissions in South Africa. Let's unpack the story for you. We're joined now by Professor Cheryl Cohen, who is head of the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases. Prof, it's always great to have you on the show with us this morning. Thanks for your time. I mean, it's worrying, the findings from this study, but are we to read into it that not only is this new variant more transmissible, but also more deadly?
So thanks for having me this morning. And I think I mean, as always with COVID, it's not quite as simple as that. So as you mentioned, I mean, we know that the new variant has come into South Africa, and we know that the recent, really big second wave that we had, one of the main contributing factors was the new variant. But one of the big questions, as you said, is really, is this variant more deadly? And the paper that we released last week really was trying to look at this. And what we found, in fact, in our paper was that we found two things. We found that certainly the mortality, the number of people who died and the proportion of people admitted to hospital who died was higher in the second wave. But we found that a big part of this, as you mentioned, was in fact because there were so many more cases, and when the hospitals get overwhelmed, patients do worse. And of course, the increased number of cases is also due to the new variant. It's because if the new variant is more infectious and there are more cases, there'll be more people in the hospitals. But what we also found is that even if we account for the increased number of cases, there was still an increase in deaths. So even if we account for the fact that there were more cases and the hospitals were full, there was still an increase in deaths. So this suggests that it is possible that the new variant is associated with an increased mortality, but it's not absolutely conclusive information. And the reason it's not absolutely conclusive is because we didn't take in a whole lot of individual people, and in each person we knew this one had the variant and this didn't, and we compared them. What we were really doing was comparing the first wave to the second wave. And so what we saw is that the second wave was more severe disease, even if we account for increased hospitalizations. But there could have been other things that changed from the first wave to the second wave, and it's very difficult to control for all of those things. Yeah. So I think our data suggests it could be so, but it's not absolutely conclusive.
I mean, if we look at the number of new infections, Prof, over the past couple of weeks, there was a period we were going through where we saw fewer than 1,000 new daily infections being reported by the health department. But over the past week or so, it's back up to over 1,000, and on some days, over 1,500 new infections. I mean, fair to say that, yes, we're on level 1, the economy is open, but we are not out of the woods.
So I think absolutely fair to say we're not out of the woods. And we know that the case numbers are relatively low, so they're much lower than they were before. But absolutely, we still have substantial numbers of cases. In the order of 1,000 cases diagnosed every day is still a large number of cases. And you must remember, many cases will still be undiagnosed. A lot of people with mild illness don't come forward and present. They don't test. So we're absolutely not out of the woods. And what is really, really important is that people continue to use their masks, to socially distance. I mean, we really are seeing now that we're on level 1 and people are allowed to have events like weddings, etc. People do seem to be relaxing, and we must really be very vigilant not to allow the fact that we're on level 1 to let our guard down and then let us give rise to super spreading events or outbreaks, because certainly there's still a lot of COVID around and people need to be careful.
Yeah, I mean, what we've seen over the past year or so of the pandemic is that we've seen situations, for example, unfolding in European countries, let's say Italy, for example, and then even though we didn't see as severe a first wave as Italy did, we did see increases in infections in the first wave, following on from what we're seeing internationally. So we're lagging behind. Having said that, we've just seen over the past week, the past few days, in fact, that Italy has once again gone into a lockdown. They are now, they say, in the midst properly of a third wave. I mean, is this a sign of things to come for South Africa?
So I think the one thing I can confidently say about COVID is I it's very difficult to predict what will happen. I think I've learned my lesson making all kinds of predictions about COVID. It's very difficult to say. I think what we can say is it is extremely likely that the cases will come up again at some point in a third wave. And I think we know that from all respiratory viruses, they have seasons and they have peaks and they have ups and downs. When that third wave will be, I think we don't know. How severe it will be, we don't know. And I'm not sure that we can really infer from Europe what will happen in South Africa.
Yeah.
I think the situation right now is very, very different in Europe. But I think we know there's still a lot of COVID around. Not everybody has had COVID. There's a lot of susceptibility in the population. And so we are at risk, and cases will come up if we relax our restrictions. That's what we know. When it will happen, I think, is very difficult to predict. And it's also not a preordained thing. When it will happen will depend on how people act and how responsible everybody is.
Do you want anything to change in terms of the lockdown that we are in currently, given that, I think around the country we're starting to feel that chill in the air that's signaling that winter is on the way? Is there anything, given the change in season, that you think we should be doing differently now?
Yeah, so I think, it's a very complex decision to balance sort of legislating restrictions on people versus the economic impact. And so I don't think that there's really anything I would want to see in terms of the lockdown or the rules and regulations. I think what we really need to see is people continuing to be responsible. And I think the vast majority of people are responsible in what they do. I think what's very, very important also, as you mentioned, we're going into winter, is for us to monitor very carefully COVID and other respiratory viruses like influenza and respiratory syncytial virus. Last year we really didn't see those viruses, and we think it was because of the interventions to control COVID. But we are really monitoring very carefully to see if they will come back this year, because, of course, for those viruses now there's been a year without immunity in the population as well. And so it is important that we monitor them, and also important is those people who are indicated to get the flu vaccine, particularly elderly people, people with underlying illnesses, pregnant women, HIV-infected people. This is the time, the vaccine is now in the country, to go out and get your flu vaccine to make sure you don't end up with a double whammy of a winter with flu and COVID. So that's an important thing that we should do.
Yeah, and Prof, whenever we have you on the show, we use it up as an opportunity to ask you all of the big questions we all have around the pandemic, and one of them certainly coming out of news reports from the last couple of days are these reports around the AstraZeneca vaccine, reports citing blood clots are involved. Ireland is one country suspending use of the vaccine. We know that the COVAX facility, which we are a member of, uses the AstraZeneca vaccine. Is this something you're concerned about?
Yeah, so I think, at this stage, really what these countries are doing is being very, very cautious. And that's what we have to do with any vaccine. A vaccine is different from other medical products. We give it to healthy people. It's not like a treatment. So vaccines have to be extremely safe. And so the principle that we have with vaccines is if there's any signal or there's any worry, we rather stop giving it and we investigate properly. But at this time, really, that's the stage that we're at. They've stopped the vaccine so that they can investigate. It's also very important to remember we are giving millions and millions of doses of these vaccines to people who are elderly and with underlying illnesses. And so elderly people with underlying illnesses have severe events all the time as well. And so the important thing with the vaccine is to work out, is it just coincidence? These people could have had these events anyway, or is it related to the vaccine? And that's quite a complex and detailed investigation that is needed. So at this time, really what they're doing is being precautionary, and that's the right thing to do. But it doesn't at all mean that they've shown conclusively an association and we need to worry about the vaccine. This is the right thing that they're doing, but I think we need to wait for the scientists to examine the evidence to see, is it really more common than we would normally see in this group of vulnerable people?
Yeah, the World Health Organization also saying that millions of people have received this vaccine without experiencing any of the blood clots that have been reported. Prof, before we let you go, in terms of our own vaccination drive in the country, 145,000 healthcare workers so far receiving the Johnson & Johnson COVID-19 vaccine. The minister himself saying, given where companies are at in terms of their own manufacturing deadlines, we may not see our target of 40 million people being vaccinated before the end of the year. Again, a question that I ask you in light of our own government's interventions with regard to staving off the pandemic.
Yeah, so I'm not particularly involved in the vaccine rollout, and so I can't comment on the details of whether we'll reach our targets or not. I think what I can say is that so far, certainly the manner in which it's been rolled out seems to be very impressive, very organized, data systems, and people really coming together to volunteer to give the vaccine. I think in terms of whether we'll reach our targets, what I can say is I think everyone is really working together to try to achieve that, but it is a difficult environment. There's a lot of competition for vaccines. But as I say, I'm not directly involved in those aspects.
Yeah, absolutely. Well, thanks very much, as always, for your perspective. Prof. Cheryl Cohen is with the National Institute for Communicable Diseases. In fact, she is the head of the Center for Respiratory Diseases and Meningitis. It's always very interesting to get your take and your analysis on these various issues.